In this morning's Health Matters, a look at spending in healthcare. We'll see the reasons why a new study says there's wasteful spending in the U.S.
Plus, leading by example. We'll see the ways that you can keep your kids active at home.
This is Good Day Central Illinois on WYZZ.
But when you're thirsty and in need of a drink, water usually seems like the most refreshing idea.
But in today's Health Minute, Andy Rose explains why water may not be the most hydrating choice.
If someone were to ask what's the best drink to keep you hydrated, you and most people would probably answer water. Well, hate to break it to you, but good old H2O may not be the best option. That's according to a study from Scotland's St. Andrews University. Researchers compared the hydration responses of several different drinks and found that, yes, water does a pretty good job, but drinks with low amounts of sugar, fat, or protein do an even better job of keeping the body hydrated for longer periods of time. The study's author and professor, Ronald Maughan, says one reason has to do with how our bodies respond to certain beverages. Consider the volume. The more you drink, the faster the drink empties from your stomach and gets into the bloodstream, where it can dilute the body's fluids and hydrate you. Another contributing factor is a drink's nutrient composition. Researchers tested 13 beverages to see which would keep you hydrated for at least a 4-hour period. The top 5: skim milk, oral rehydration solutions like Pedialyte, full fat milk, orange juice, and cola. Water and sparkling water ranked 10th and 11th. I'm Andy Rose reporting.
It's time now for this morning's Health Matters. There's a new study published in the medical journal JAMA that's looking at healthcare spending. It finds that up to a quarter of all U.S. healthcare spending is wasteful. In fact, researchers found $760 to $935 billion healthcare dollars are wasted every year. The biggest reason is administrative issues related to billing and coding. That represented 28 to 35% of total waste. Other factors are overtreatment, unnecessary hospital visits, and a lack of preventative care. The United States spends more on health care per capita than any other developed nation.
Exercise is good for you, but it's particularly good for cancer patients. That's what researchers from Pittsburgh and Italy suggest. A tailored exercise program for cancer patients during and after chemotherapy may prevent or reverse heart damage related to their treatment. Chemotherapy is known to increase the risk for cardiovascular disease. The team believes that endurance training may be good for overall heart performance. Resistance training could help frail patients. Deep breathing muscle training is better for thoracic cancer patients.
Prospective dads should lay off alcohol for months before getting ready to become a father. That's what researchers at the Central South University in China say. Fathers-to-be should stop drinking alcohol at least 6 months before conceiving a child. The idea is to help prevent against health risks. Some include congenital heart disease, heart defects, and birth defects. Regular drinking, even 3 months before conception, raises congenital heart disease risks to 44%. Binge drinking raises those risks to 52%.
The American Medical Association says the average total cholesterol among U.S. kids has dropped 9 points. The report finds that the level of bad cholesterol, or LDL, fell. Meanwhile, the levels of good cholesterol, or HDL, rose in less than 2 decades. Scientists say this trend could point to some good signs for kids' cardiovascular health in the future. Excess cholesterol, generally from foods, can build up on the walls of blood vessels, and then that causes them to narrow and restrict blood flow to the heart. Exercise and a healthy diet will help keep cholesterol levels at the right levels.
Moms and dads can keep their kids active by being active people themselves. A recent study looked at data on more than 4,000 students. It says if kids believe their parents are active people, they are more likely to be active themselves. This is especially true if kids think mom got regular physical exercise. Experts do say parents don't have to be training for a marathon. Instead, something as simple as a family walk will help keep kids moving.
Also this morning, it's never too early to get the flu shot, and it turns out the best time is right now.
Dina Centofanti has the latest on the fall flu season.
Fall is here, so here's the question. When do I need to get that flu shot? Well, the answer is pretty easy. It's right now. The Centers for Disease Control and Prevention saying we need to take this seriously. They're concerned about the flu season this year. The agency saying a child and adults in California have already died from the flu. So too soon to know at this point just how severe the flu will be or how effective that flu shot will be. But this year's vaccine has been upgraded to include the severe influenza A virus. That's what we were dealing with last year when we got that second flu wave late in the flu season. Remember that? And even if it's not a match for what goes around this time, officials say the immunity boost provided by the vaccine is designed to make the flu less severe if you get that shot.
You may get the flu shot and may catch the flu, but a different